A deadly and fast-moving fungal superbug, Candida auris, is making alarming inroads across the United States, with New York alone reporting 2,000 cases, more than any other state. The situation has escalated to such a degree that the Centers for Disease Control and Prevention, CDC, has labeled C. auris an urgent threat, a designation reserved for pathogens that are not only hard to treat, but pose a serious public health risk. This pathogen isn't just spreading, it's doing so with deadly consequences, proving fatal in up to 60% of infected cases, particularly among vulnerable patients in hospitals and long-term care facilities. Unlike other infectious diseases that present early warning signs or clear symptoms, C. auris often flies under the radar. Many individuals carry the fungus without ever realizing it, becoming silent vectors for its spread. For those who do show symptoms, the outcomes can be severe. Persistent fever and chills, dangerously low blood pressure, rashes, and, in the worst cases, invasive bloodstream infections that are notoriously difficult to treat. The stealthy nature of this pathogen means it often goes undetected until it has already taken hold, at which point treatment options may be limited or ineffective. This isn't a hypothetical threat. From 2016 to 2023, the CDC documented 10,788 confirmed cases in the United States. What's truly disturbing is the rate of acceleration. The fungus is no longer a slow-moving anomaly, but a fast-spreading pathogen establishing firm footholds in healthcare systems. The fact that a single state, New York, has already tallied close to 2,000 cases underscores how deeply embedded and potentially unmanageable this crisis is becoming. 90 new cases have already emerged in the state this year alone, showing that the fungus is not only persisting but accelerating its spread. What makes C. auris so dangerous is its resistance to antifungal treatments. Unlike most fungal infections, which respond to standard therapies, C. auris often shrugs off the drugs meant to eradicate it. This drug resistance isn't just a medical inconvenience, it's a death sentence for many of the most at-risk patients. Those in intensive care units, elderly individuals in nursing homes, and patients with weakened immune systems are especially vulnerable, and the margins for effective intervention are shrinking rapidly. Hospitals and care facilities, already stretched thin by years of battling COVID-19 and other infectious threats, now face a new challenge that hides in plain sight. C. auris can survive on surfaces for extended periods and resists many common disinfectants. It's not just about patient-to-patient transmission. The environment itself becomes a breeding ground. Once introduced into a facility, it can become endemic, recurring, and resistant to eradication despite deep cleaning and isolation efforts. The consequences for infection control protocols are immense and potentially insurmountable. Even more concerning is that a sixth genetic type of Candida auris has now been identified. This discovery indicates that the pathogen is still evolving, potentially acquiring new capabilities to evade both treatment and detection. The emergence of new strains raises the risk that current testing methods will become outdated or ineffective, further complicating the efforts of already overwhelmed public health systems. This is a silent crisis. Unlike COVID-19, which arrived with dramatic flare and media saturation, C. auris is creeping into hospitals, nursing homes, and long-term care centers quietly, but with deadly efficiency. Public awareness remains dangerously low, which gives the pathogen more time to entrench itself while experts scramble to find effective countermeasures. There is no vaccine, no guaranteed treatment, and no cure on the horizon. What's most chilling is that this superbug represents just one front in a much larger, looming war against antimicrobial resistance. The age of miracle drugs, when antibiotics and antifungals could be relied on to fix almost anything, is rapidly ending. If C. auris continues to spread, it could serve as a harbinger of a post-antibiotic world where common infections once again become untreatable and deadly. The CDC's warning must be taken seriously. Healthcare systems need immediate support to ramp up infection control protocols, improve testing infrastructure, and develop new antifungal drugs. Facilities need better training, more isolation rooms, and access to disinfectants proven to kill fungal pathogens. And at the national level, There must be a coordinated response before this outbreak becomes endemic across the country. For now, the public should be vigilant, especially when visiting hospitals or caring for high-risk individuals. Candida auris may not yet be a household name, but if its trajectory continues unchecked, it soon will be. And by then, the damage may already be irreversible.